This test we're going to be working with is a pregnancy test using the EIA method. We're going to need to wash our hands, put on gloves, any other protective equipment, and we will need our urine specimen. We are going to need a transfer pipette, and we're going to need the test. So what you're going to do is, if this has been refrigerated, maybe the patient brought in their first morning urine and it had been refrigerated, you'd let that warm to room temperature. And then on here, on the bottom, probably you could write with a Sharpie, you could write the patient's last name, first initial. And then we're going to draw up in our pipette a little bit of urine. We're going to place a few drops there. And the test is starting to work. You'll be able to see the liquid rise up in the window. You don't want to do this in front of the patient. It can cause a lot of anticipation. And you'll notice that there's a C and a T. That means control and the test. So the control is going to come up one line just to show that the test is working. And then the test is going to show up if it's positive. So we'll always have at least one line, but if it's a positive, we'll have two lines. And we are just about completed with this test. And it's only showing up one line in the control. So that would indicate that this patient was not pregnant. So then we would document that in the patient's chart. We will throw everything away in the proper container. Anything, our urine and things we will put in the biohazard. And then we will clean this area with disinfectant, take our gloves off, and wash our hands. So that's it for the pregnancy test using the EIA method.